Hi, I'm Brianne Buell, VMware's Director of Healthcare and Life Sciences Solutions.
And I'm Cameron Llewellyn, our Director of Healthcare ISVs and Strategic Alliances.
We sit within a team called the Strategic Ecosystem and Industry Solutions Team, also known as SICE, and we're tasked with building vertical solutions and messaging alongside our ecosystem partners. In this session, we'll be talking about the state of healthcare and how VMware is positioned to participate in and even help shape the way healthcare is evolving.
Healthcare is evolving at such a rate that we think there's a lot of things that might be advantageous for you to know, and we look forward to sharing them today.
But first, let's get a glimpse of what healthcare actually looks like today. So some of these might look familiar to you. The first photo on the left was an image that started popping up more frequently during the pandemic when the seriousness of physician burnout was being talked about, probably for the first time in such a widespread public way. And even as we're seeing the pandemic wane, this issue of burnout has reached its own epidemic proportions. We're hearing that about 63% of physicians are reporting signs of burnout, like emotional exhaustion and depersonalization, at least once per week. And with the ratio of patients to doctors growing, things like system inefficiencies, administrative burden, and technology requirements are all compounding this issue.
And it seems like everyone knows at least one person that participated in the healthcare system during the pandemic. So burnout looks like a lot of things, but today we have the tools to efficiently help people to not only feel more like they're human, but to deliver better care through those tools.
Exactly. Yeah, not to be treated like cogs in a wheel these days. So the last photo illustrates how integrated digital health has become into our daily lives, from wearables and implants that help us track vitals or adherence trends, to applications that support the physician workflows and patient engagement. And honestly, the data that's generated from digital health in and of itself is really changing the way we prevent and treat diseases.
Yeah, I mean, if the second photo is the state of today, right, then that digital footprint is the footprint of tomorrow, and I can only imagine how much longer that record gets. And we really have to be careful. How do we secure that data?
So, with all of that in mind, let's dive into how VMware is enabling the future of healthcare delivery. You can see here we've got at least 5 different ways that we can help to enable. Let's dive in. So healthcare runs on VMware today. We have a really long history of partnering with providers and healthcare ISVs to ensure an always-on service delivery for healthcare. And according to Definitive Healthcare, VMware is the #1 infrastructure vendor, the #1 mobile device management, and the #1 deployed virtual desktop solution.
And of course,
Cam?
the bottom number that pops out there is the 94% of Epic customers run on VMware.
Mhm.
That's really important because our team, as you know, is focused and dedicated to supporting the EMR, which is really the lifeblood of any healthcare system.
We have a very large community and an ecosystem of partners to help customers along this journey. We've got over 1,100 technology partners that help to complete our industry-specific solutions. We have over 20,000 resellers who are experts in designing the data center, private, public, and edge cloud architectures, and over 4,000 service providers for multi-cloud and hosted solution needs. The big message here is that we just cannot do this alone. We need our partners in order to create the biggest impact in this sector, which has been evolving over the past 3 years at the fastest pace that we've seen.
And I
Cam?
came from a partner background here at
Mhm.
VMware, and I certainly can appreciate how our partners contribute to distributing the new technology that makes healthcare run faster, but then also helping us to improve. And so, one of the things that I make sure to emphasize is that we have continued to evolve our own partner system. And you should make sure you talk to your partner manager to learn about the new ways that you can make money with VMware in the cloud and especially the apps. I'm so excited about this.
Well, we'll get to all of that. But first, let's talk about how healthcare has changed. So, we've seen several trends that have been sneaking into healthcare over the past decade. But the pandemic had a way of really speeding things up and helping to sort out a lot of these priority areas. Um, big message is that overall healthcare delivery has just changed. You've got your technology savvy populations that are increasingly accepting of device monitoring, their every movement, and they're looking for their healthcare providers to have the same kind of insights as their mobile phone provider. Then on the other side, staff are looking for more flexibility where appropriate, and healthcare organizations are seeing the benefits in being able to hire for certain roles, including the back office, finance, and IT roles from across the country. And this has been expanding their candidate choices. And as for health IT, in many ways, the shackles that have held back progress are really starting to come off.
I agree.
So let's dig a bit deeper then into the patient experience side of things. So we must enable how and where we meet the patient. The standard four walls of the hospital have been extended to provide care via remote monitoring, remote patient monitoring. The hospital at home has really ushered in a new discharge strategy that enables lower acuity patients to be monitored at home. And modern applications now provide the ability to track vitals, medication adherence, and to self-report. And all of this data flows across various clouds where it securely transports into the single source of truth, which is the EHR. We're continuing to see new innovations in how data is triaged from disparate locations. And because VMware is the fabric of how patients are engaged with mobile device management, our Workspace ONE and supporting services allows healthcare to be virtualized and scaled. Now let's shift over to the provider experience. We see that there's a new dynamic digital employee experience that we've seen grow since the pandemic. We've got this sudden shift to remote work, and that didn't just happen in the corporate world, it happened in healthcare too. And much of that trend has stuck around. You've got both clinical and non-clinical workflows being carried out from any location, and VMware is enabling this. In case in point, we're supporting new dynamic workflows like diagnostic radiology to be extended to the home. We're also seeing care teams that manage care across the continuum securely access patient data via Horizon. And this allows them to coordinate and manage care from anywhere, whether you're from the home, any other remote location, or even clinical retail centers, which we'll get to later on.
And just for our resellers too, you might also hear this referred to as the digital clinical experience, digital physician experience, or a physician's or provider's toolkit.
Yeah, and we've been getting used to the distributed workforce for some time, and hybrid seems to be on the steady growth path. When we've got organizations trying to work out how to deliver it. So, according to a lot of research, many organizations think that they would lose employees if they were to discontinue hybrid work and remote work. So this is definitely a trend that's here to stay.
Agreed. So now let's talk a little bit about the multi-cloud experience. And I think that it's really important to understand that multi-cloud is on a rapid adoption phase, but understanding the difference between cloud chaos, where we feel like a lot of our customers start out, and what we call cloud smart here at VMware, it's a road that really depends on the trust of the reseller and the trust of the customer in VMware. And when I think about these, experiences, of course, I want to kind of give you guys some subject matter. So let's think about clinical and claims data, the DevOps experience, really important when it comes to how we're engaging patients and treating them more like consumers. I would think about data paths across disparate data silos. Everyone understands that the thought is that you would like to have it sort of be the Lord of the things, right, with your cloud, but really it's not one cloud to rule them all. It's more of a multi-cloud strategy. It's a hybrid cloud strategy for each workload to fit where it should appropriately run. We think about data lakes and also data repositories. And really, both of those are really important when we consider how we are looking at to analyze data to deliver better outcomes. Ultimately, the better your data, the faster you can have access to it. Those are the things that turn into actionable differences. And so for our multi-cloud experience, it comes down to the fact that we have a family, if you will, of SaaS services that are used to develop, run, manage, connect, secure, and access any app on any cloud. If your app platform isn't built, right, to deploy cloud native apps consistently across any environment, on-prem, private cloud, multi-cloud, if it's not streamlined and where you have a self-service developer, so that you can experience Kubernetes that fits the development team's preferred activities versus what's being enforced, right? They want open workflows. They want to be able to automate the toil of infrastructure and packaging and security. Cloud management is the same thing as it used to be, except for now it's got extra complexity. So our management is to make sure that any of your apps, your infrastructure, are going to run consistently in a unified governance and with visibility and lab performance and into something that you can track cost across all of your on-premise, private cloud, public cloud, and edge infrastructure, right? That's industry leading technology. And the reason why it continues to see a lot of adoption is because it produces the outcomes that our customers want. I want to make sure I touch on cloud and edge because I do feel like that's another hot topic. But just know that our cloud infrastructure includes VMware Cloud Foundation, and that lets you support traditional enterprise modern apps and provides a complete set of highly secure software-defined services for compute, storage, network, security, Kubernetes, and cloud management. Security and networking, none of this really happens without it. So we want to make sure we deliver that security and networking and as a built-in distributed service, right? Think from the data center to the device, we do have a security profile that can't be matched in the industry. And so whether you think about your private cloud, public cloud, edge environments, just know that our solutions include NSX. So that helps to provide entire network model coverage. So wherever you're going to create or provision to your network topology, think about doing it in seconds, not minutes, and deliver all your critical apps and services faster and easier. And then last but not least, Brie already touched on it really, the Anywhere Workplace. I'm not going to go over it because she just did, but let's just be honest. We want to treat our employees like whole humans and giving them access for our on-premise, private cloud, public cloud, edge, like you've heard me say it multiple times, with dual factor authentication where it's necessary is critical to being a modern healthcare environment. And honestly, our customers need you to help them understand that. Brie?
Yeah, I mean, the cloud certainly creates a lot of potential, but we've seen that moving to the cloud can be full of challenges. And that's why we're here. We're here to help and partner with everyone to make sure that this can move effectively.
So this is probably my favorite slide, as we kind of alluded to, but modern applications, right? It's not your grandmother's app, and in fact, your grandmother's app probably runs better. The consumer experience that we're seeing in healthcare that was talked about, ad nauseum during the pandemic of, your digital front door, but really what we're asking is, hey, do your patients enjoy your portal? Do they enjoy interacting with your health system digitally? And if they don't, do you really have an in-house plan, right? Are you thinking about an API strategy for how you want to approach them? There's a couple of questions that are really easy ones, right? But if you want to ask your customers, what is your platform strategy for enabling telehealth? That is a very basic question. Do you have an internal application modernization strategy? Meaning that are you thinking about what you would like to do engaging your customers versus really following industry trends? How will patient engagement really impact your revenue goals? That's a big one for me because, again, when we started to have a decentralized workforce, keeping engagement was really important. And there is a part of healthcare that is going to be experiencing a lot of change that I'm going to really refer to in a minute. But for all of our traditional customers, they should be thinking about all of that. Because if you don't have a strategy for home monitoring, for remote clinical trials, for everything that I'm talking about in terms of the consumerization of healthcare, then you are going to miss the boat as we transition from a fee-based service to a value-based service. So when you think of value and you think about the application, to marry those two things requires a strategy. And VMware is here to help you with our application platform. Tanzu. Brie?
Beautiful. Couldn't say it better myself.
I'm sure you could actually, but let's go for security. So intrinsic security, I think everyone understands this, and I kind of touched on it before. But if we think about some central questions that you could ask your customer, things that will really get them thinking about it, is what's your worst case IT security scenario in cyberspace for your organization, right? I'm sure everyone asks them questions, but if you ask it in this way, I think you get a more meaningful response. And if you back it up, right, with an understanding and a strategy of what their threat vectors are, we usually see that you can drive conversations that are meaningful and ultimately come back to where VMware can help with intrinsic security. If you ask them again, how do you assess your IT security vulnerabilities and risks? Your risk profile, the threat vectors, as we continue to see all of the things that we just talked about, all of those different endpoints. If you can consider, right? What is the emergence of new advanced technologies like ChatGPT? How does that impact what you guys are going to do internally? And what is your strategy to protect medical devices? With the proliferation of medical devices that we see inside the body, but then also outside, then obviously we don't want to have that information getting out. And of course, healthcare continues to be one of the largest targets for ransomware, ransom as a service as well. So asking those questions, I think, leads to a lot of great conversations with us internally, and it's a great way to really get to know VMware strategy, which again, from the data center to devices, alone in the industry. Next, Bree.
Yeah, and honestly, we know that about 90% of global data comes from the healthcare industry. And
Mm-hmm.
so when you put that into perspective, you can see how important it is to make sure that information is being analyzed, used, shared in the most secure way.
Next up, though, most important now is this transition, something that's really happening across the world. And it is an outgrowth of the pandemic. The fact that decentralized healthcare meant better outcomes for everyone, right? We didn't want to have a buy one, get one free when people were having COVID. You go in for a broken arm and you come out with COVID, the outcomes were really scary for a while. And so that's where we started to see the rise of clinical retail. Think of players like CVS, uh, Walgreens, of course, Walmart here, which we'll talk about in a moment, Albertsons, even the Dollar General, Best Buy, are all getting into healthcare, and that's going to radically change what the healthcare model looks like, which currently is, if you think about an upside down triangle of the number of people that flow into the system, there's a large general population that has, a cold, a cut, a suture, a broken arm, but then that filters down into specialists who ultimately drive essentially the consumption of healthcare and who we really want to facilitate making it easier. We talked about some of the access and some of the burnout earlier in the conversation. But now when we start to drill down into what clinical retail represents, it represents the shift from fee-based service, right? Which is kind of a mystery to most people, right? You don't necessarily know what it costs to go to the doctor, what your scans cost. One of the worst sort of indictments of healthcare is that healthcare knows about healthcare. Your doctor and your nurse always seem to know more about your standard of care than you do. But as we see people like Walmart getting into healthcare, we're seeing transparency. We're seeing the availability of services at the edge for the people who are uninsured and underinsured. And so clinical retail represents one of the largest segments that we see growing over the next couple of years. Bree?
There are great implications for health equity as well in this rise of clinical retail when you consider that a lot of hospitals right now are having some major revenue issues, and a lot of hospitals are closing, especially in more rural communities. And so the rise of clinical retail provides a place for those people to go and still get some form of healthcare. So it really helps to kind of bring up the underserved communities and still provide them a way to access some of that care. It's a really fascinating area. And our team has been doing a lot to kind of pull together some solutions to approach the rise of clinical retail as well.
That's right. We continue to see things in telehealth. And, I was interested to see the perspective of one clinical retailer that's going to look to address loneliness, right? You can have loneliness calls, acne, hair loss, right? Things that I would have considered, for dermatology to be a specialist. But really, I want to just kind of also call out again that we have had a lot of growth on our Horizon Cloud on Azure, a specialized sort of point of care to point of sales service in collaboration with Microsoft. And as you can see there in purple, we are enabling Walmart to access to their Epic instance from every new location that they're opening in the United States. I can't tell you how meaningful that is in terms of helping to interoperability and helping ultimately to bring better outcomes. Most people live within a pretty short radius to a Walmart, and they're part of a greater strategy. But I love the fact that we're helping them to integrate all of this into their existing business of retail with organic food choices, wellness, consumer grade medical peripherals, and that these integrations are ultimately delivering better clinical care outcomes, right? By being a disruptor. And it's one of the most exciting things that we're doing today.
Yeah, and it says here, as of this writing, there have been over 25 nationwide clinics deployed at Walmart locations. That was not too long ago. I think this was maybe 6 to 9 months ago, and now they have over 32. So that shows how quickly they're deploying this across all their locations. It's
Agreed.
very telling of the industry. Well, that's it from us. I know we covered a lot here. Obviously, if you have any questions, you're welcome to reach out to Cam or myself, We will pop our contact information into the chat. So feel free to email us with any additional questions you might have after today. And then, of course, for more information, we do have a blog page dedicated to our healthcare vertical. So please take a look at this, and hopefully you see something that strikes your fancy and you want to talk to us about it. We love to engage with you. Again, we can't do this alone. We love our partners. So let's do this together.
Yes, thanks so much, Bree. It's always a pleasure, and we look forward to helping you all sell. So that's from Cameron Llewellyn, Bree and Buell signing off.
All right. See ya.